Hello everyone, I'm Dr. Bissell, the Director of the New River Health District. Today's October 23rd, and I'm going to give you a brief update on the COVID-19 situation in our area. Keep sending us your questions and concerns. Our answers will be posted on the NRV Road to Wellness website. We continue to have community spread of COVID, but we're seeing signs that people are getting tired of taking precautions. Please remember that COVID doesn't get tired of us, and as soon as we relax, it will spread. Although large parties are problematic, we're seeing a trend that it's the smaller social interactions that are spreading COVID in the community this month. In particular, we ask everyone who carpools to wear their masks and wash their hands. Our kids are not getting COVID on the soccer field, but in the car rides they share going to practice and other places. We are finding the same thing with workers hopping in the car to go to lunch or carpooling together. Masks do work. They are universal source control, reducing the amount of COVID spread by an infected person, but they also reduce how much a contact breathes in. We are finding that people who wear masks are not getting COVID, and if they do, it's a mild case. We're seeing more examples of this around the world. For example, in an outbreak of an infected woman visiting a coffee shop in Korea, none of the masked employees caught the disease, yet visitors who were not masked did catch and spread COVID. Our businesses are working hard to establish and maintain good practices, but it doesn't help if our workers fail to follow protocols in social settings. We are seeing other evidence of COVID fatigue in our community. We ask that anyone who has gotten a COVID test to quarantine while waiting for the results. If you have symptoms, please stay home. This is a global pandemic. We ask that you not spread the disease in the community where there are people who will be seriously affected. We have a number of questions this week about data and tests. This pandemic is giving everyone an opportunity to better understand how data can be used and misused. Health data has several uses. Sometimes there are competing priorities which are different and can be confusing to families, individuals, and organizations trying to make decisions. As information is spread and shared in articles, we urge you all to do your research, to read more than just the headlines, and to read the article in its entirety. Often the media has shocking headlines, especially in relation to COVID-19. However, this leads people to take information out of context and put assumptions out on social media that just aren't correct. Lots of data is regularly released to the public, but it often comes without that context. We continue to do these community updates weekly, and hopefully you can make the best decisions to stay well and protect others. We each have the power and responsibility to assess our own risk. If you are higher risk and uncomfortable with going to a friend's house, please don't go. If you want to enter a park or other activity and see too many people there for your comfort, you have the power to choose not to join. However, in a world where we are continually told what not to do, we have learned enough about this disease to help you connect socially. You can see your friends and family. However, you need to be careful about spreading the virus and avoid it. Your best place to meet is outdoors. Dress warmly, wear a mask, and enjoy natural ventilation. Thank you for your continued support and patience as the pandemic continues. We have to remain vigilant. Remember to stay informed, watch your distance, wear your mask, wash your hands, and don't touch your face. And please stay home if you're sick. Thank you.